Hi friends, welcome to Plexus Ortho. My name is Dr. Kannan Kumar. I am an orthopedic consultant at Bangalore. So going ahead with the questions that we were discussing, we're going to discuss the next question that I put up in the Telegram channel a couple of days ago. So this is a question which says, a 49-year-old male presented with pain in the wrist after a fall on an outstretched hand. What is the name of this radiological sign on this X-ray? So this is a two-step question. The first step you have to find out what the diagnosis is, and the second step you have to find out what is the radiological sign. So let's look at this wrist X-ray. He fell on an outstretched hand. Outstretched hand can cause all kinds of injuries, including scaphoid fractures, distal radius fractures, elbow fractures, and up to the clavicle. So a fall on an outstretched hand is a good indication that there is some kind of trauma. So what you see in this X-ray, we see the radius, the ulna, and the carpal bones. What is significant about the carpal bones here? You can see an increased space between the scaphoid here and the lunate. You can see that the space between the other bones, lunate and triquetrum, are very minimal, whereas the space between the scaphoid and lunate is increased. This is because the scapholunate ligament is injured, and this is called as scapholunate dissociation. This can occur both acutely and chronic over a period of time as well. So this is a case of scapholunate dissociation. So what happens in scapholunate dissociation? We can see that we have an increase in the space between the scaphoid and lunate. This indicates that there is some kind of disruption to the ligamentous attachment between the scaphoid and lunate, and that's why it goes like this, right? So what is this sign called? All of you should remember this is a factual memory, that it has to go into. It is called Terry Thomas sign. Why is it called Terry Thomas sign? Because a British comedian had a gap in his teeth similar to the scapholunate dissociation or a scapholunate ligament injury, and therefore it was named after him and called as Terry Thomas sign. Quite a few of you got this correct, so it's a difficult question. So I'm very happy about that as well. So let's go into a little bit of detail about the scapholunate dissociation. So when you see that normally the lunate and the scaphoid have a connection between these two, it's called scapholunate ligament. It is thickest at the dorsal side, and when they are disrupted, the bones move apart, and not only do they move apart, the scaphoid flexes, and the lunate extends. So the lunate is like this and the scaphoid is like this. Scaphoid flexes because there's no connection between them, and the lunate starts to extend. So this is what happens in scapholunate dissociation, and this is that comedian who had a gap between his teeth, and therefore it was called as Terry Thomas sign. This has been asked previously in your exam, so it's an important fact to remember, and make sure that you don't miss this question in your exams. So what were the other options in the question? One was Gilula's line. Gilula's lines are, this is a normal wrist X-ray. In Gilula's line, there is a smooth curve in the proximal portion of the proximal carpal bone. What are the carpal bones? All of you know that. Scaphoid, lunate, triquetrum, pisiform. This is the proximal row. Then you have the trapezium, trapezoid, capitate, and hamate. What is a mnemonic? All of us know. She looks too pretty, try to catch her. That was the mnemonic that we learned during our MBBS days, and therefore it's a very simple one to remember. So it's called SLTP, that is scaphoid, lunate, triquetrum, and pisiform in the proximal pole, trapezium, trapezoid, capitate, and hamate in the distal row. So the Gilula's line there are three lines here, one in the proximal portion of the proximal row, and the distal portion of the proximal row, and the proximal portion of the distal row. So there are three Gilula's line, and these must be smooth. If they are disrupted, then you can have what is called as lunate and perilunate dislocations, and different other injuries must be looked for. Okay. So you can see in this picture, it's very commonly asked, perilunate and lunate dislocation. What is this? This is lunate dislocation. Why? Because the lunate has spilled off or has come off the radius. So this is called as lunate dislocation, where the rest of the corpus is in line with the radius, whereas the lunate has come off. So lunate dislocation. This has also been asked in your exams, so you have to remember this. The second type of dislocation at the wrist is called as perilunate dislocation, where the lunate remains in line with the radius whereas the rest of the corpus has moved away. So this is called as perilunate dislocation. Very simple to remember. So remember this so that you can get these questions right. So what are some of the other radiographs they can show? One is a scaphoid fracture. All of you should be able to recognize a scaphoid fracture. Now, very common question: scaphoid has a higher chance of going into AVN. Which portion of the scaphoid has a higher chance of going into AVN? It's a proximal pole fracture. So let us say if this is the scaphoid, the proximal pole fractures have a higher chance of going to AVN. Why? Because the blood supply comes from dorsally and distally. So if this is disrupted, there's a high chance of going for AVN. The next, but the commonest fracture that can occur is a waist fracture. Remember that. The commonest fracture of the scaphoid is a waist fracture. But if they give a combination of waist and proximal pole fractures and say which one goes into AVN, then it is the proximal pole which has a higher chance of going into AVN. So these are the few things that within 4-5 minutes I could describe about wrist injuries and what you can get in the exam. So make sure you don't miss these questions. Good luck and study hard. And my name is Dr. Kannan Kumar from Plexus Ortho. Thank you very much.